Hello, how you doing? Good evening, and I trust you're well, and I hope you are safe as well. So, at this particular moment, we are going to be joined by Richard Wangungu, who is a geriatric nurse practitioner in the USA, and he's going to tell us more about what he does. And yeah, so if you have any questions for him, you can go ahead and also ask him. Thank you. Richard,
Yes,
you're welcome. You're welcome. Kindly
very, very,
share about what you do so that our viewers can get to interact with you.
very well, very well. Ms. Violet, thank you for inviting me to this show. I must say that I'm really happy to be able to talk to you guys. Like Violet introduced me, my name is Richard Wagongo. Violet calls me Wangongo, but I'm actually Wagongo. And I am a nurse practitioner who does what they normally call on this side post-acute care. This is where you are able to take care of patients who come from the hospital who are discharged after they had an acute issue going on, whether it's a surgery, whether it's things like hypertension, diabetes. So
Uh-huh.
basically, we take over from the hospitals and then we take care of them from there. We also do rounds to some other patients at the hospitals as well. So it depends with where you are located on that week. So now you asked a question regarding whether I've taken care of COVID patients. I must say that I haven't come across to a COVID patient just yet. That doesn't mean that it's not going to happen in the future. I have had, I have come across patients who are having the symptoms, and so we have tested them for COVID. And thankfully enough, they haven't come to be on the other side of being negative. So that's a good thing. I must say that it's nerve-wracking. Anytime you have a patient who is having some shortness of breath, who are coughing, who have that dry.
Who are? Yes, Richard. Seems like Richard is breaking off, but I think it's the internet, but I know he's going to come back soon. So let's wait a minute. So Richard,
Hello, did they kick me out?
yeah. Richard,
Yes.
yeah, you've disappeared for a minute. Maybe you can refresh your internet and then log in again.
Okay, I will.
Okay.
Yeah.
Sorry, viewers, I was just getting in touch with Richard, so I was telling him to refresh his internet. So as Richard joins us also once again in a few, this is the situation in the USA. There has been an increase in the number of people who have died in the USA, and we'd like also to get to hear from Richard to get to know like which state he's in and what is currently happening over there. So Richard,
Yes, I
thanks
am back.
for
Yes.
okay, awesome. Thanks
Yes.
that you joined us once again. So I wanted to ask you like you told me that you're a geriatric nurse practitioner. What does a
Yes.
geriatric nurse practitioner basically do?
So geriatric nurse practitioner, basically you practice with the older the older population. So our population ranges, between kutoka from 18 and up, but we kind of find ourselves taking care of the older generation from 65 and up. So basically, I'm mandated to take care of patients from all the way from 18 and up. But again, our population is mostly skewed to under 65 and up.
Okay. And you
Yes.
had mentioned that you had mentioned that you operate in 2 states.
Yes.
You said Missouri and which other state?
And Kansas.
And Kansas.
Yeah, so
And
basically Missouri and Kansas, they are states that border each other. So in terms of even in terms of the practice of medicine, we are able to have hospitals and facilities on both sides of the state.
Oh, okay.
Yeah.
And like, has your state been affected?
Yeah, very well. We have been affected for quite a bit. Huh? Our total confirmed cases right now stands at 33,327 confirmed cases. And of
Okay.
course, we have about 58 deaths as of today. That is on the Missouri side. Now, when you go to the Kansas side, we have about I think it's about 1,046. That is the confirmed cases, and then 38 deaths.
Wow.
So that is for both. Yeah.
So the 38 deaths are both for Missouri and Kansas.
No. So the 38 is the deaths in Kansas, and then the Missouri is the 58. So Missouri, there's more deaths and also more confirmed cases.
Okay. So the other thing that was mentioned is that like the COVID-19 is affecting the older generation more than the younger generation. So since your sole responsibility is taking care of the older generation, so have many of them been infected now in Kansas and Missouri?
No, and I'll tell you why. I think one of the things that the CDC and the CMS is generally the organization or the department that is mandated in monitoring and basically regulating what they normally call the long-term post-acute care facilities. What they did, and I must recommend them for what they did, because at the very early stages of these whole menace, they restricted the movement of in and out of the long-term acute care facilities. Basically, what people normally call the nursing homes. But I think we've moved from calling them the nursing homes to what now they call the post-acute care facilities. They restricted the movement. This was very early in the game, and I think this was way back in early February when they stopped the movement. So basically, these homes are now shut down, where the only people that are able to go in are the essential providers. And I think that has resulted to paying in a lot of dividends, because basically the only people that are able to go in are the nurses and special providers. Like I am the only person who is allowed to go into several of my buildings. So, and this has really, really helped.
Yeah. And I heard Donald Trump say that like now the protective materials, now the PPE, the unlimited stock, have they now been made available for you as practitioners?
Yes, and I must say that the media, I have said this many times, that the media coverage of this whole thing has really been productive, because I bet you, why not for the media calling and repeating and saying we would never have gotten to this. I myself right now have a bunch of gloves over here. I have several N95s. I have a couple of face masks. I have some goggles. So this has really been ramped up. I have had our company itself, it has contracted Chinese companies. So the whole PPE thing has been addressed very well. That I must say. That I have to keep saying that there was an outpouring support. Local production has been heightened. And so we just have to be thankful about that.
And so I wanted to ask another question. Like President Trump was blaming the governors of the different states of not taking action. That is why there has been an increase in the number of people who are infected with COVID-19. So I just wanted to know, like, do you support him on that, or what do you think about the governor's actions, especially like in New York, which is the epicenter, though now it has grown to other epicenters. Do you think that governors have bear the sole responsibility for the increase
Very, very well. I
of the
must start by
COVID-19?
saying, yeah, I must start by saying that I myself am as progressive as they get, and so my assessment of Donald Trump, I'm gonna try to be as objective as I can, but I must say that he has really, really messed up this whole thing. Because to begin with, I don't think generally in this country we try not to pass the buck. When there's an issue, when there's an epidemic, people normally come together and face it head on. And so I think his criticism of Governor Cuomo has, to me, it's unfortunate because I don't think anybody has seen this. I know this thing we've been learning on the go. Everybody is learning on the go. He himself, even Trump himself, he has to take the blame himself. Certainly, initially, I have to say the governor of New York and even the mayor himself, Mayor de Blasio, they kind of had a lukewarm thing of this. But I think, as anybody, nobody expected this thing to get to where it has. But I think once they caught fire, once they understood, I think we just have to admire what they've been able to do. Initially, there was the whole thing. Oh, I think it was Mayor de Blasio who said, this thing is just going to get by. He wanted people to continue doing what they are doing in their lives. But I think once they realized, once the media highlighted the urgency of the matter, the issues, I think you just have to admire what they have been able to do. So to answer your question, I think the attack on Cuomo, on de Blasio, is unfortunate in my view.
All right. So the other question that I have is with regard now to the chloroquine, the hydrochloroquine, the one that President Trump also keeps reiterating that it has cured people from COVID-19. So, are you using that? Are you using hydrochloroquine to treat your patients there, or do you think that it can be administered out of hospital for outpatients?
I certainly wouldn't. And I'll tell you why. I think you have the last 24 to 48 hours, you have seen the American Heart Association, and you've seen a lot of cardiology groups come out and say, and be very wary about this medication, because what it has some side effects that especially when taken alongside other heart medication, whether you're talking about ACE inhibitors or whether you're talking about beta blockers, you've had a lot of cardiologists saying, hey, let's hold on to this medication because of what it can potentially do to the heart. But most importantly, personally, I'm very skeptical about the medication itself because the studies are still going on. The verdict is still ongoing. And I know one of the things that hydroxychloroquine does, it's an autoimmune medication. It works on the immune system. So here is the thing about this medication. It is helping patients in certain ways, because what hydroxychloroquine normally does. It slows down your immune system. So, and I think what you are finding most providers say is that we just don't know. We are not sure about this medication. And I think the president talking about this medication a lot is a very unfortunate thing, because I don't know if you've been able to get to watch most of those press conferences. Dr. Bass and Dr. Fauci, most of those guys stay away from selling, or touting or talking about this medication because the evidence is just not there. There is a very small sample of patients that have been able to benefit from this medication, and so from a medication, from a medicine point of view, we're trying to stay away from selling it. Actually, the group that I work for, we've been restricted from ordering this medication outside the normal, outside the routine, outside the malaria, outside the rheumatoid arthritis. We are not ordering this medication. We are staying away from it, to answer your question.
Okay. Now, the other question that I have is, like, Are there fellow practitioners like yourself who have been infected with COVID-19 at the hospital? Because like when we talked earlier, you told me that you are conducting rounds at the hospital. Yeah.
Yes. So here in Missouri, I'm yet to find out of a colleague. We do have another. Our group is large. It's actually nationwide. So we did have a colleague get infected. I think it was in Texas, and actually ended up dying, which is an unfortunate information. Unfortunately, I cannot reveal their name and all that because that is privileged information. So our group so far is just one individual, and she actually ended up passing on, which is a very unfortunate situation. But about regarding colleagues, it's mostly in New York. Unfortunately, that is where it has happened. I went to school here in Missouri, and so none of my colleagues have had of any infection right now. We, thankfully to God, we are all safe for now.
Okay, and I'd also like to ask, like, what message do you have, like, for even fellow practitioners also here in Kenya, who are visiting now, who are attending to patients? Do you have a message? Yeah.
So here is what I have to say. Like I told you earlier, I get to see patients every day who came from the hospital, you know. And as you know, every patient right now who comes from the hospital, we are treating them as what we normally call a PYE, you know, a patient, a person of interest or a person under investigation. And here is why. Not everybody is being tested for COVID at the hospital. Not everybody. You know, looking at most of the charts, patients are not actually being tested, all of them. And so you don't know who was at the hospital and got an infection from the hospital. So how I'm approaching this is every single time I go into the room, I am washing my hands very well. I am putting my mask on. I actually have one. I just took it off right now. And so I'm treating every patient as a potential COVID case. And that's how I would advise them. You go into a room to see a patient, make sure you wash your hands, make sure you put your gloves on, make sure you put your mask on, and avoid coming into contact with them as much as possible. I know for us, most medical practitioners, we are people who are full of empathy. Usually on a normal day, when I go to see a patient, I want to be as close as possible to them. I want to empathize with them. I want to shake their hand. But as you know, right now we are trying to do away with that as much as possible. I like to shake hands with my patients because there's that connection that I care. There's that connection that I want you to get well. But unfortunately, right now we just have to understand. We just have to make them understand. And so that would be my advice to guys over there in Kenya. Try to avoid. I know there's that feeling. There's that wanting. Try to limit it as much as possible. Again, if the government has made it available to you to have a mask, utilize it. If the government has made it available for you to have some gloves, utilize it. And treat every patient as a person of interest. That would be my advice.
All right. Like in the US, they have stated that like most of the people who are being infected are African Americans. Okay, so that means the blacks, isn't it? So does it mean like the ones who have been born in the USA, or does it also include even Africans who have come to the US? So what do they exactly mean by African Americans are the ones who have contracted the coronavirus?
Okay, so let me explain this, and I think that's a very, very good question, and here is how this is working. First of all, to start this, you have to go back. You have to go back and think about how this is all tied up. To me, this is more of a socio-economic situation, okay? And here is how. So African Americans, in a way, they have found themselves in what you normally call a systematic situation. if you go to, I don't know, Violet, I know you have traveled quite a bit. I'm sure your audience have also traveled quite a bit. But if you go to most airports, especially in New York, Chicago, most metropolitan, you realize that most of the people who are working into those places are normally African Americans. Okay, if you go to the people who normally drive, or ride the metro, the metro, the subways, or the people who run the railway system, most of them are usually
Okay.
African Americans. Okay,
Yeah.
so the exposure is mostly to them because they're the people who are in the service industry. Now, if you think about a place like New York, the reason that there are so many infections in New York City is because New York is a place where people visit a lot, and the Chinese are known to travel, whether it's in Africa, whether it's in New York, whether it's in Vegas. So that is where most of the Chinese people landed. They landed in New York, and what did they bring? They brought the virus to New York City. And so who was the ready recipient for the virus? It was the people who were working in the service industry. It was the people at the airport. It was the people at the metros. It was the people who ride the subway. So those are the people who received this. Now, most importantly, the second point I would like to talk about, and this is very important, is in terms of the people who are dying. It is the same thing. It is the same African American. And and I'll tell you why. Most of the people who normally have the comorbidities that are uncontrolled, whether it's the diabetes that is uncontrolled, whether it's the hypertension that is controlled, whether it's the cancer that is diagnosed in its later stages, are mostly African Americans. And why? Why is that? It is because they do not have the same access to healthcare like our Caucasian colleagues. Why is that? Our Caucasian colleagues are economically empowered, so they are able to access healthcare better than African Americans. So so take a case of a patient who has diabetes that is uncontrolled, hypertension that is uncontrolled, and then here they have cancer, and then all of a sudden now they have a virus in them. So that patient who has those comorbidities that are not controlled is more likely to die than a fellow Caucasian who gets the same virus, but their blood sugar is controlled, or they probably don't have it, their hypertension is controlled, or they most likely don't have it, or they don't even have cancer. Okay? So this whole thing is tied up to your socio-economic status. So if an African like me is here, but I see my doctor regularly, so my hypertension is controlled, my diabetes is controlled, I'm most likely not going to die from this thing. And then the other thing is, where do I work? Where do I stay? Do I ride do I ride the subway? Do I ride the train? So there are many things that are tied up to this whole narrative, to answer your question.
Oh, okay, awesome. Now, now after you are done with your shift,
yes.
Do you go back home, or you have been allocated maybe sleeping rooms at the hospital? Because the reason why I'm asking, the reason why I'm asking is because they want also to minimize you infecting even your family members back at home that you've left them. So I just wanted to know, like, what do you do exactly so that to ensure that the people you have left at home, when you go back home, they are not infected?
Very well. I personally go back home, and I know most of my colleagues are going back home. Even the ones that are staying at the hospital, they go back home. But like I told you over here, I think there's one point that is being missed over here about the medical practitioner. We are professionals. So what it means for our family. So, like I said, I have the white coat that you see me wearing. This one, I leave it over here. Like I said, I have to put on a mask when I come in. I have to wash hands when I come in and out. My temperature is checked in when I come in and when I go. And obviously, like I said, I wash my hands. I take off my clothes. I have, so there are different things that we are doing, even our own. And this is something that, like I said, infections are not new. We have what we normally call the superbugs, right? The C. diff infection, Massa infection. So for medical practitioner, this is something that we have dealt with for a long, long time. Before I started working for this group that I'm working right now, I used to work for another one, for another hospital that was literally every room you had to gown up to. There were even more dangerous. You see the thing about the virus. I know it's dangerous. People are scared about it, but for medical professionals, this is our world. This is what we do. We do infection from January through December. So, personally, or even my colleagues that I know, we are still doing our thing. We go home, but we do those extra things, and I think that's what we're doing.
Okay.
Yeah.
In line with that, I wanted to ask, like, how do you cope psychologically, especially with regards to now to the COVID-19, considering that many health workers, frontline workers, have become infected. So how do you deal psychologically with this issue every time you wake up to go to work?
I think first of all, you just have to trust in God. That's a big thing. And then you talk to colleagues, and then information. I am personally one person who consumes a lot of information. I'm an avid listener. Like you probably seen from my Facebook posting, I listen to the press conference very well, and I take that information and I put it in my practice. Of course, I'm able to sift, take the good information, and through reading widely, listening to experts, I'm able to kind of mitigate the risk. I look and say, I look at data, I look at closely what was happening in China, and I see what a huge impact wearing a mask head. I look at what washing hands mean, and I'm personally somebody who is able to observe my own symptoms. So basically, looking at information and practicing in a more disciplined way. Discipline is key. Of course, you're not gonna go to if a patient is like over here where I am today. When a patient have even the mildest cough, we are able to isolate them. We are able to put gowns on their doors. We are able to put them on separate halls. So just being disciplined and being observant, that's what I'm doing. It's just basic discipline and being observant. And of course, trusting in God.
All right. I also wanted to ask, like, at this time, you find that healthcare systems all over the world are being tested. All right. So I want to ask, like, in the US, how is the healthcare system there, especially at this time of COVID-19?
Very well. I must say, like I said earlier, I am as progressive they get. And so I'm basically a Democrat. And I think what we've talked over the years, we talked about a single payer, a healthcare system that would cover everybody. That is what I would want. I was a pro-Obama as they could get. And so Obamacare was really helping. But the last 2-3 years, the Republican Party has decimated it. They have tried to destroy it as much as they can. Every opportunity they have seen, they've tried to destroy it. And I think that is coming back to bite us. Okay, it's really, really coming to bite us. That is why you see people dying like flies in New York City. Like I said, I personally feel really bad. I feel bad when I get a patient who I look at them and I see their diabetes is uncontrolled. I look at their hypertension is controlled. I see that their cancer was diagnosed in its later stages. That normally breaks my heart. And the only reason that those things happen is because they are not able to access care. Okay, so right now the government over here have said that a patient will get free testing, for the coronavirus. Patient will, and I think they are even waiving, even those who have private insurance, they are waiving their copay, because there's normally what they normally call copay over here, where if you go to a hospital, you see a doctor, there's normally a portion that you pay, the insurance pays. So they are waiving that right now. And so what I have to say in terms of how our healthcare system is doing, we will have to look at that later. Because right now the government is waiving all these, people are not yet receiving the bills, So I think this is something that we're going to have to look back. We cannot tell how it is doing right now. We'll have to look at on the other end of the spectacle.
Okay, and then I have a question. Like, how are you dealing with the how are you conducting like A&C visits, antenatal care for pregnant women, and also for those ones who are for the women who have just given birth. So especially at this time of COVID-19, and if one of them is infected. Is there a way of preventing it from it infecting the child? Kindly elaborate.
Very well. That's a good question. But like I told you, I am a geriatric nurse practitioner, so I rarely ever come up, unless that's an information that you probably have to come to somebody who practices closely with women. They are nurse practitioners who deal specifically with that, and that will not be my area. I wouldn't have any information regarding that.
All right, like in the obstetrics. So
Yes,
I'd like to ask, how is life now for you and your family?
Well, life is basically okay. We are doing fine. Over here in Missouri, the governor just issued the lockdown, I think, earlier this week. Before that, the mayor, because over here, we have the state, and then we have the county, and then we have the city. So the guidelines that we are working right now are from the mayor. So basically, all we are learning right now are the essential services. So like you can see, I haven't had my hair cut. Wife and the baby are staying at home right now. I'm the only person who is able to get out. So, and again, we're in a city where we cannot go to church. That's the only opportunity we normally meant to meet other Kenyans is when you go to the church, and the church has been closed this is the third week where we are just doing the online church thingy. We cannot, we can walk, we can get out and walk, we cannot go to the mall. Like I said, the baby cannot go to the baby care. She's staying at home right now with the mother. What else can we not do? So basically, life is not normal. There's no doubt. We normally do home food, so we are not really people who go out and eat in restaurants a lot. So we are doing our thing like we normally do. But for most people, the only thing you can do right now is get food through the drive-through or a pickup. You cannot go sit on any restaurant. So almost all restaurants is just drive-through and pickup. That's about it for now.
So lastly, I'd like to ask you to maybe give a word of motivation to the youth here in Kenya, because you were studying here in Kenya, in Nyeri County, and you excelled, and you are now in the US. Right now, are you a citizen there, or?
Yeah, I am a citizen myself. Yeah.
Yeah. So because like yours is also like a dream, many even Kenyans here, some of them dream of coming to the US to come and work, and also maybe so I just wanted to ask to ask you to maybe share a word of motivation to young people, especially at this time of COVID-19. What should they do with their lives? What should they give up hope, or what message do you have for them?
They should not give up. And here is why I should say that. So COVID-19 will come and go, okay? And I think, in as much as I disagree with Donald Trump, I like one thing that he keeps saying, that we will come out of this stronger. And so I think there will be opportunities. I'm somebody who likes looking at, I like looking at most menaces or most epidemics or most pandemics in a positive way. Something good is going to come out of this. So, and the reason I would like to say that, Violet, as like you say, like you correctly mentioned, I schooled over there. I went to the Rumora Boys, and then I came here back in 2004. I went to a university called University of Central Missouri. I studied economics and finance. I graduated back in 2008. And the reason I'm bringing this up is because it can encourage somebody. I graduated in 2008, right when the economic crisis was starting to hit. So here I graduate in economics and finance, and then I started looking for a job. And what was happening in 2008 was exactly where we are today. So I graduate, try to look for a job, and companies were laying off right and left and right, right and left, whatever you want to call it. And so I decided that instead of looking for a job and competing with people who had these good resumes and people who had worked for the World Bank, had worked for a Bank of America. I decided to go back to school and become a nurse because the starting salary for an economist back then was horrible. And again, when you are born, when you are born in Africa, you have your accent, you are black, and then somebody else is white, and they were born here, they have excellent capability. And so I decided to go back and become a nurse. And so I decided to become a nurse. I worked myself up and then ended up becoming a nurse practitioner. And I know most people probably are asking, what is a nurse practitioner? You have a white coat, what do you do? So basically, as a nurse practitioner, you work, you collaborate with the doctor. I have a collaborating doctor. Right now they are working somewhere else. But over here, I pretty much approach the role of a doctor. I'm able to prescribe medication. I'm able to prescribe labs. I'm able to prescribe, X-rays. So I basically play a doctor's role. And so what I would like to say to the youth, do not give up. Take this as a challenge. Get out there. Even if you say you graduated with a bachelor's, whatever, do what you can do. Hey, get out there and do something with your life. It doesn't matter how much low it means. Like I said, personally, I graduated with a bachelor's of economics and finance. I'm an economist, as I talk to you. But I looked at the situation back in 2008 and decided to make something out of myself. Right now, like I said, I hold a master's in nursing.
Wow.
So a master's in nursing, and I still have my bachelor's. So I understand most things most people do from the economic world, the finance world, and then the nursing world. And so what I would like to do is issue a challenge to the youth. No matter what you hold, you might be holding a bachelor's in this and that, but again, take an opportunity. Look at this whole COVID-19. Look at this whole crisis, and see how can I make myself. How can I enjoy myself? How can I do better for myself using this situation and take those opportunities and run with it?
Wow, wow, wow. That is
Yes,
so deep. So
yes,
I
yes,
want to
yes,
say thank you, Richard, for joining
yes,
us on
yes,
on this platform.
yes,
And even thank you for sharing the COVID-19 experience,
yes,
your experience in the USA, especially in Kansas and Missouri.
Missouri, yes,
And thank you even for the word of motivation. So
yes.
viewers, if you have not yet subscribed to this channel, kindly go ahead and subscribe because we'll be having more of these real talk shows. And thank you, thank you, Richard, even for joining us once again. And this was our first YouTube live,
My
eh?
pleasure, my pleasure,
YouTube live edition. So you are the inaugural one, okay?
my pleasure. I
So
appreciate it.
yeah, yeah. So we are going to share the video link with the various people so that they can get to hear what you said. So thank
I
you so
appreciate
much,
it.
and do enjoy your. Is it morning or?
It's in the afternoon. It's actually 1 o'clock in the afternoon.
Oh, and it's 9:11 over here. All right.
Yes.
See you then, and we'll keep in touch as well. Okay. Thank you so
All
much.
right.
Eh?
All right. All right.
Thank.
Barakatara. Thank you. Bye.
Aya, asante.